our member spotlight, it is my pleasure to introduce one of our members and actually one of our biggest sponsors, our presenting sponsor for the Nevada Housing Conference the last 2 years, Anthem. And I'd like to welcome Lisa Bogard.
Thank you so much. It's a pleasure to be here.
Great. Lisa, can you just give a brief overview of Anthem for our audience and maybe start the connections with affordable housing?
Sure. Yeah. You know, it certainly is it's a true honor for me to serve as a senior leader for Anthem Blue Cross and Blue Shield. It's been over 16 years now, especially because Blue Cross and Blue Shield has, you know, one of the most recognized brands in the United States. 1 in 8 Americans hold a Blue Cross and Blue Shield member card, which equates to about 117 million people across the nation and approximately 10.4 million people in those 25 states who are Medicaid members. So when we think about the breadth of the experience that Anthem brings and the focus that we have on housing, it's pretty incredible. So it not only makes us one of the most recognized brands, but also one of the most trusted brands because healthcare is incredibly personal. And it's really important that we are really focusing on not just the health, but the whole person. And that includes social determinants of health. So I'm really proud that we've been able to bring Anthem's history and experience and resources to Nevada. And we have over 50 years of experience here in Nevada as a trusted partner. And 12 years with our state partner for Medicaid. So we really offer service plans for, many life needs. That includes Medicaid, Medicare, employer-sponsored insurance. We have the federal employee coverage, specialty, vision, dental plans, and ACA exchange plans. And we also provide millions, really tens of millions of dollars each year to address state and community needs. And that includes health, social, and other life needs. So that certainly includes housing. Anthem really believes, is committed to the housing because housing saves lives.
Awesome. And your leadership role at Anthem is so appreciated. You've not only been a sponsor of the conference, but you've participated as a panelist, and your voice and representation of the Medicaid arm really has shown that connection to housing. So thank you so much. Which really brings me to my next point, an exciting space for Anthem, a new position this year that you created to show, that I think shows your commitment to affordable housing, was a specific person. Emily Paulsen is with us here this morning to share her role with Anthem and her commitment to affordable housing. Emily.
Hi, good morning, Christine. Thank you for the spotlight opportunity. I'm Emily Paulsen. I'm the Housing Program Manager with Anthem Nevada Medicaid.
Fantastic. So I know you started with Anthem this fall. So about 6 months ago, as you've been getting your feet under you with this new position and these new opportunities, and of course you have a strong understanding and grasp of our housing needs, particularly for the Medicaid audience or those of lower incomes. How do you see Anthem relative to housing and really being part of our solutions as we move forward?
Yeah, I'm really proud of the work that we're doing at Anthem. We know that housing improves our members' health in numerous ways. And I'd actually like to share a story that I think captures how important our housing programs are for our most vulnerable members. This story is about a member who is 54 years old and who was homeless for 16 years. Between 2019 and the time we housed him, he had visited the ER 353 times and was admitted 44 of those times. Most of these admissions were due to psychosis and suicidal ideations. One of our amazing behavioral health case managers was able to build rapport and trust with this member, and she found out that he was using the hospital oftentimes as a safe place to sleep and to get out of the harsh Nevada winter. This member had been referred to supportive group housing several times, but he didn't do well there because of his paranoia and he was uncomfortable sharing a room with other people. He also wasn't adhering to his medication treatment orders, which resulted in some problematic behaviors that led to him being evicted for non-compliance of housing rules. But that didn't deter us. We wrapped more support around the member and placed him in our Healthy Living permanent supportive housing program. And through the trust he gained with our behavioral health case manager and our peer support specialist, the member eventually agreed to try long-acting injectable medication to manage his psychosis and his mental health needs. This really helped him to stabilize. He's now regularly receiving long-acting injectables to help him manage his mental health, and he's successfully stayed housed and is no longer cycling in and out of the ER. So we think the story really highlights the importance of housing and how difficult it would have been for this member and many of the members we serve in the absence of housing for them to receive the health care that they need.
That's a powerful story, and thank you. That Nevadan is so representative of others in needs. And it also shows that oftentimes our community members, our neighbors, Nevadans in need more than just a shelter. So I appreciate that. Well, you've been a huge supporter of the coalition now. You know, we're fairly young and you've been there really almost since the beginning. But what would you like to see from the coalition as we look forward even just this year?
Yeah, also proud to be a member of the Housing Coalition. We'd love to see the coalition continue to support strategies for the development of more affordable housing, specifically for people in permanent supportive housing and with income at 0 to 30% of the area median income. So those are extremely low income Nevadans. The scarcity of units that's currently available is really hurting our ability to scale up permanent supportive housing and rapid rehousing, because even if our health plan supports the cost of the programming and the leasing for our members, we still need the inventory of housing to be available to us and to our homeless service provider partners. So the limited capacity of those units is really hurting our ability to scale up the interventions that we'd like to support our members with.
Yeah, thanks for highlighting. You know, Nevada does unfortunately lead the country in terms of the least and most severe shortage of housing for our Nevadans in extremely low income. So yes, that is a priority. I appreciate the support. We're going to keep working towards that. So thank you so much. Lisa, just in closing, I just want to ask you if there's anything else from Anthem that you'd like to share with our members and stakeholders.
Yeah, thank you so much. You know, really, I mentioned it before, but it's so important. You know, Anthem, we really focus on whole person health. And so our Elevate Population Health Program focuses on the individual's needs, whether that's behavioral health, which we know is so important as we come out of this pandemic, physical health, emotional well-being, you know, and other factors that really contribute to the individual's overall wellness. And that includes housing. So we support that whole person health by making sure that we offer, you know, a large selection of doctors. We not only want to have a large selection, but we want to have a diverse population that the members really can get a chance to choose and connect with a provider that they can trust. We also support, again, those social determinants of health. That's education, employment, housing, social justice, transportation, health equity, all of these things together, really working with the community to create these extra benefits that address social determinants of health is key in helping members on their journey. The community outreach, we build strong relationships with our members as well as the communities. And we actually hold, you know, fun and educational events that really promote that access to care. And then lastly, as we mentioned, you know, serving on boards and committees through the state, it really gives us an opportunity to give a voice, you know, for our members and our providers. So again, I firmly am committed and believe that housing is health and housing saves lives. And Anthem is an organization that's committed to improving health and the lives of Nevadans. Thank you.
Awesome. Thank you both so much, Emily and Lisa, for sharing. And thank you to Anthem for your commitment to Nevadans and to affordable housing.